Yes, okay.
So could you please just introduce yourself again and tell me just briefly about what the CSO does?
My name is Dr. Wah Wah Maung, the Director General of Central Statistical Organization under the Ministry of Planning and Finance. CSO is serving as a secretariat to improve the CRVS system in Myanmar, civil registration and vital status system in Myanmar. Actually, we have the cooperation mechanism to improve the CRVS system in Myanmar. The Minister for Health and Sports is leading the national level Vital Status Committee, and I'm serving as a secretary of that national level committee to improve the CRVS system in Myanmar. But we have another focal stakeholder departments like General Administration Department under the Ministry of Home Affairs and the Immigration and Population Department.
Can you tell me a little bit about why agencies working together is so important in the CRVS system?
Yes, actually, CRVS system is, the task of the CRVS system is very much cross-cutting among the departments, concerned departments, so that, to improve the CRVS system, we need to cooperate, coordinate, and collaborate among our, concerned departments. Especially, this is our civic responsibility to inform for the, birth registration and death registration. So to improve that data, it will be very beneficial for our country, for the relevant national planners to receive this kind of, quality data for their evidence-based planning and resource allocation, and as well as the monitoring and evaluation of the work. Yes, so that it will be beneficial for the other departments, other stakeholders as well. So to improve that CRVS system, the four focal agencies are trying together to improve it.
Wonderful. Can you tell me a little bit about the expected impact that you think that the Data for Health initiative will have on the quality of data?
Yes, firstly, before we start this project, we have our, assessment survey. Actually, we need to identify our, our system's weaknesses and loopholes first, and then we can identify. After identifying our weaknesses, then we started to, started to formulate our activities, strategic activities to improve the national statistical system. And also, we need to strengthen the cooperation mechanism among the stakeholders and focal departments. For us, the Ministry of Health and Sports is serving as a civil registrar for the, birth and death registration, so that CSO is serving, for the data entry and as well as for the data processing, and also writing the report for the vital status and the, explaining the situation. So according to the data, we need to transform from data to policy. That is why, we together with the report, we also have to include the policy recommendations for the country, so that this is the collaboration work between the CSO and Ministry of Health and Sports.
So I know that there's plans that are being formulated in terms of sustainable development of your CRDS system after the Data for Health initiative. Can you just talk me through that a little bit?
Yes, this project can provide
Sorry,
us.
I think your mic is hitting this a little bit. Yeah. So if we could just do that, is that okay?
Yeah,
okay.
yes.
Sorry, if we could just start over.
So, this project is a pilot project which covers 42 townships in Myanmar. We have, 365 townships in Myanmar. Although this is the, a pilot project, it can formulate us, how we can proceed for our sustainability, and also it can identify the weaknesses of our system, and we could continue to implement to use our own resources in the future, so that how we can manage the data, how we can improve the IT infrastructure for the data entry, and also how we can strengthen the bowel autopsy methods, to estimate the community deaths, and also how to extend and improve the coverage, registration coverage, so that the project provides us a lot of experiences for all the concerned departments to improve the implementation in the future, so that it is very beneficial for us. It can improve our know-how, and also the technology, and as well as the monitoring and evaluation skills for our implementation of the projects.
Thank you.
Yes.
Well said. And you briefly spoke about the 5-year CRBS strategy.
Yes.
Can you again just kind of briefly talk about why that's important?
Yes, actually, we need to, when we got to know our loopholes and weaknesses, we need to, firstly, we need to extend and improve our, registration, birth and death registration and coverage, so that we need to organize the awareness raising workshops, to inform to the community for the notification, especially notification for birth and death registration, and as well as we have to form the technical working groups. We have 3 technical working groups, and the respective technical working groups has to work on their areas to improve. For example, MCCOD and ICT 10 coding, and also the trainings of the trainers, and also trainings at the local level, so that we have step-by-step works to continue for the implementation of the project, and moreover, for the sustainability, we need to harmonize our format and forms. For example, birth registration form, we have the death registration form. It has to be harmonized with the standard format of WHO. That is why we need to have the consultation with all the department concerned to harmonize the collection of the data format and forms. After that, we try to include in the curricula of the public health universities, medical curriculums, so that we need to consult with the professors and the rectors of those universities, because we want all the health staffs, this is they are according to the their ethic, this is the to improve their ethical value. This is not the extra work for them. This is as a responsibility as a medical officer, they have to work, so that we are trying to include in their curriculum, medical curriculum, and as well as in their public health courses, so that we are trying to include them. And then for the future, the current medical students and current health staffs, who are being trained in those universities and colleges, they will got to know this is the process we have to do when they are recruited as a medical officers of the ministries. And then, for the existing staffs, we need to carry on our training. For the time being, we have already trained more than 1,000 staffs for the MCCOD plus ICT Golden, so that we will, even if this project has completed in the next year, we need to carry on those trainings, and also we have to try to extend the activities, those strategic activities, into other areas, not even those project townships, but also we need to extend to the another non-project townships.
That's all I had to ask you. Is there any kind of other things that you think are important to include when we're talking about CRBS and data quality in Myanmar, and I guess the future after Data for Health? Is there anything else you want to say?
Yes, regarding this Data for Health initiative, we really appreciate of Professor Alan Lopez and his team from Melbourne University, and also we would like to express our sincere appreciation to the Myanmar country office staffs led by Ms. Sandabu, and I really appreciate of the close collaboration from other Ministry of Health and other focal departments like General Administration Department and the Department of Immigration and Population. With our close personal relations, we need to strengthen our cooperation, not only at the headquarter level, but also at the states and regional level and local level. So this is I am very proud of this initiative and successful implementation in Myanmar. It is very beneficial for our country to continue to strengthen CRVS system in Myanmar, so that we take the ownership, country ownership for the strengthening of CRVS system in Myanmar. Thank you so much.
Thank you.
Yeah.